Okay. Okay. Well, hello, everyone. I am Patricia Dwyer, as you know, and I wanted to just briefly introduce Lisa, who is going to be presenting her dissertation today. She's a speech language pathologist for 21 years. She's currently the director of related services for Anne Arundel Community Public School. Before that, she worked at Shepherd Pratt, where she was there for 15 years and worked her way up the ranks to become clinical director. And I just wanted to mention Deanna very quickly. She's a graduate of this program. And so it was really wonderful that she got a chance to be on this committee. And she's doing amazing work, advocacy for equity in education, starting all kinds of nonprofits. So she was a wonderful addition to the conversation.
All right, wonderful. So Lisa, do you have material to share? You should be able to share.
All
right.
And I'm just going to move my toolbar over so I can quickly. Okay. Alrighty. Okay, can you guys see it okay? Okay, wonderful. Thank you so much, Dr. Dwyer. Hello, as mentioned, my name is Lisa Brodjieski. I'm a speech language pathologist with 21 years of experience in the field. My role has included serving as a clinical mentor, supervisor, and professional hiring manager. Seeing firsthand the challenges faced by early career professionals and not always knowing the best way to support inspired my desire to learn more about where the problems may be stemming from. And from there, a study was born. My study investigated how training and supervision impact professional competencies for speech language pathologists. And I want to thank you for the opportunity to share my research today. I would like to extend my sincere gratitude to my PhD committee, Dr. Dwyer, Dr. Fenster, and Dr. Latimer-Hearn. I truly appreciate all of the encouragement, support, and patience extended to me during this process. Today, I will briefly highlight sections of the dissertation, including the introduction, literature review, research method, research findings, and conclusion. We will start with the introduction to the study. Speech language pathologists, also called SLPs, help with a wide range of issues, including preventing, diagnosing, and treating speech, language, communication, and swallowing disorders. Studies suggest that only about 25 to 30% of people are familiar with the full scope of what a speech language pathologist does. Many people associate SLPs primarily with treating speech disorders, but they may not be aware that SLPs have a very broad scope of practice. They are essential in helping individuals of all ages improve their ability to communicate effectively and safely in daily life. SLPs work with people of all ages to assess and treat speech challenges, such as articulation, voice, and fluency, and language issues, such as understanding, expression, grammar. This includes working with people who have developmental, acquired, or brain-related language disorders. SLPs also diagnose and treat swallowing problems known as dysphagia, which can happen due to neurological conditions or injuries. They also help with cognitive issues like attention, memory, and problem solving, often after brain injuries or strokes. On top of that, SLPs are involved in education, prevention, and advocating for good communication practices. By the very nature of their role, SLPs work with a variety of professionals in an array of medical, clinical, and educational settings, and must be committed to working cooperatively with team members for the benefit of their patients' or students' care. All places that hire SLPs face challenges with keeping positions filled with qualified professionals. After finishing the tough graduate coursework and clinical training, it becomes clear that being a successful SLP takes more than just clinical knowledge, skills, and energy. Surviving in this demanding and specialized field requires essential skills that aren't always taught in traditional graduate programs, especially those with a clinical emphasis. This is complicated by the fact that qualifications and expertise of SLPs cannot be duplicated by members of other professions. The demands in the field are growing quickly. Burnout and stress are making it harder to recruit and keep SLPs. The shortages and high turnover are only increasing, and the extra workload for those still in the field can make burnout even worse. Students do not automatically learn how to be a competent professional just by being part of a graduate program. They learn through a systematic approach to learning and guided experiences. Speech-language graduate school programs are prime opportunities to offer intentional and relevant professional skill development due to their associated teacher learning process, clinical mentoring, and clinical practicums. Stress and burnout are a major factor when it comes to recruiting and retaining SLPs. Research shows that about 65% of SLPs are expected to leave their jobs within 3 to 5 years. Some challenges in the field include speech-language pathology programs don't always clearly focus on the professional skills that SLPs need. There's a lot of variation in training and learning experiences, which means graduates are unevenly prepared. And to do well in the field, SLPs need strong clinical and professional skills to be effective in their roles. Next, we will discuss highlights from the literature review. There's a big gap in research on how to identify, develop, and strengthen the professional skills of SLPs. Without enough focus on this, new SLPs might feel unprepared, which can ultimately lead to stress and burnout and add to staffing shortages. The field of speech pathology is still growing, and professional role models are evolving too. Being professionally competent means having the knowledge, skills, and qualities that are valued by professional organizations. For SLPs certified by the American Speech Language Hearing Association, also known as ASHA, key skills include cultural awareness and sensitivity, strong clinical reasoning, effective communication, and using collaborative and evidence-based practices. But the challenge is these skills aren't always clearly highlighted as must-haves for getting into or staying in the profession. In a field that's always evolving, the demands and expectations for SLPs are getting more complex. This shows that now, more than ever, it's just as important for graduate students to develop both technical skills and core professional competencies. Many SLPs take on more than they can manage in their first 5 years, which can lead to burnout fairly quickly. Right now, there are 310 ASHA-accredited graduate programs, and because you need a master's degree for entry-level positions, getting in is extremely competitive. Only the top students are typically considered, and some say it's as competitive as getting into medical school. With the field growing so quickly, there just aren't enough educational opportunities to meet the demand. More research in the field is helping professionals better understand the early signs and hallmarks of speech and language disorders throughout the lifespan. With people living longer and surviving earlier, there's a growing need for SLPs to support specialized populations. Training is key to effective supervision. However, the minimal requirements from ASHA do not reflect the urgency for targeted formal training and have not evolved to meet the demands of changing populations. Across the country, SLPs are being asked to work with larger, more diverse, and medically complex groups, all while dealing with tougher billing practices and more accountability. The experiential learning framework by Kolb guided this study, which considered the intersections of targeted curriculum, high-impact learning practices, and skilled supervision to foster core professional competencies. Using Kolb's experiential learning cycle, I looked at how combining classroom learning with hands-on experience and support in graduate school can help build clinical and professional skills. The 4 key ideas focused on concrete learning, abstract thinking, active experimentation, and reflecting on what's learned. Each of these ideas helped guide the review and interpretation of the data related to perceptions of early career SLPs. We will now move to the research method for this study. A 57-question survey tool was designed, and data were collected and used for statistical analysis. The study was designed to fill a gap in research related to the development of professional competency standards by obtaining perspectives of early career SLPs firsthand. Two types of data analysis were used to examine the responses provided by the early career SLPs. Quantitative methods were used to understand and make comparisons between data, including statistical analyses, Likert scale items, and demographic questions. Qualitative analyses were used to examine the types of responses offered by respondents on structured, open-ended survey questions to identify emerging themes and enhance the story told through quantitative data. Saldana's triangulation approach suggests looking at a phenomenon from different perspectives to get a deeper and clearer understanding of the research. This is especially important in fields like education or health, where lots of factors are at play. By combining both types of data, the study gave a well-rounded look at the challenges early career SLPs face when moving from academic environments to clinical practice. 6 research questions served as the foundation for the study, directing the focus of the investigation and shaping the methodology. Questions 1 and 2 investigated concrete learning and abstract conceptualization. Questions 3 and 4 examined active experimentation and reflective observation. Research questions 5 and 6 explored impact. We will now consider the research findings. There were 215 respondents who participated in the study. Results revealed a vast majority of respondents work full-time, and a plurality of respondents work in a school district and have 3 to 5 years of experience. Concrete learning helps early career SLPs dive into both the theory and clinical content, helping them understand evidence-based practice. For each research question, a multiple regression analysis with ordinal data treated as interval data was conducted. For research question 1, all the factors, perception of faculty knowledge, perception of instructional strategies, and satisfaction with graduate program were linked to higher perceptions of professional competency. Abstract conceptualization enables early career SLPs to translate curriculum into practical knowledge through interprofessional experiences. For research question 2, 2 of the predictors, perception of quality of curriculum and perception of quality of supervision, related to greater perceptions of professional competency. Active experimentation lets early career SLPs try out their ideas in real-life situations through working with other professionals. For the third research question, the analysis showed that one factor, how confident they felt clinically, was linked to higher perceptions of professional competency. Reflective observation gives early career SLPs a chance to look back and analyze their first experiences with instruction and supervision. For the fourth research question, the analysis showed that factors like how positively they viewed their clinical performance, how satisfied they were with their graduate program, and how happy they were with their supervision were all linked to higher perceptions of professional competency. Survey questions looked at how perceptions of instruction and supervision affected burnout. For the fifth research question, the analysis showed that effective instruction was linked to less burnout in the early years, while work experience was connected to more burnout. The survey questions looked at how early preparation experience affects job retention. For the sixth research question, the analysis showed that both effective instruction and strong supervision were significantly linked to higher job retention in the early years of professional work. The qualitative findings revealed a mixed picture of early careers SLP views on their training and how it shaped their professional skills. While many agreed that their instruction and supervision were valuable, a lot of them were concerned about the curriculum's relevance, the inconsistency in the quality of supervision, and how well it prepared them for real-life challenges. Notably, quality and variety were key factors in shaping their professional roles and skills. Finally, we move to the discussion and conclusions of the research. The study highlighted a gap between traditional training and the current demands of the field, suggesting that graduate schools may be having trouble keeping pace with changes in the profession. Being successful in the field of speech-language pathology takes much more than clinical acumen. Skills like communication, problem solving, and flexibility are key. These professional skills aren't always emphasized directly in graduate programs, but they're essential for SLPs to do well in real-life situations. Building these competencies early help SLPs handle the expectations and challenges of the job more effectively. When analyzing the results, findings showed that overall, 53% of SLPs surveyed reported that instruction and supervision did not foster professional competencies in the field. The findings indicated that respondents felt instruction and supervision were the most effective in promoting the development of clinical reasoning skills, while cultural competence received the least emphasis, highlighting a gap in focus and exposure to all the necessary skills. The study found while graduate programs may be preparing students for the traditional idea of clinical competency, those skills alone might not fully cover the challenges today's SLPs face. Rethinking how we define professional skills to keep up with new content, teaching methods, and inclusivity could really improve early career training and clinical practice. Most teaching for allied health professionals still follows a teacher-centered approach, but Kolb's experiential learning theory suggests a different way, where learners go through a 4-step cycle, engaging with the material, reflecting on it, making sense of their experiences, and applying what they've learned to new situations. A big part of Kolb's theory is taking abstract ideas and applying them to real-life scenarios. However, survey results from this study indicated that only 48% of participants felt that their faculty utilized high-impact instructional methods. As the findings emerged, it became clear that improving education and support systems is a key to developing competent, resilient, and happy professionals in the field of speech-language pathology. Directly engaging with supervisors through high-impact practices in a clinical environment is a unique opportunity to build professional attributes in a supported way. This study could serve as a call for stakeholders to work together in updating education and professional standards to better align with the challenges of the field. Alarming findings from this study revealed that 89% of respondents reported that they have experienced burnout symptoms, such as professional isolation, emotional exhaustion, and a low sense of accomplishment. Of those who reported burnout, 61% rated it as significant. And 68% of respondents agreed that their burnout is related to their early preparation experiences, including instruction and supervision. The top 3 contributing factors leading to burnout are workload, supporting specialized populations, and lack of confidence. Research shows, did I skip one? Sorry. When it comes to job retention, the results showed a concerning trend. 84% of respondents were thinking about leaving the field, with many saying they'd stick around only until a better opportunity came along. This really shows how important it is for grad programs to better prepare SLPs with the skills and confidence they need to succeed and feel more satisfied in their jobs. Research shows that when an SLP feels their workload is too much, they're more likely to experience higher stress and burnout. The findings from this study also showed that when SLPs feel supported by both instruction and supervision, they're more likely to stick with their jobs in the early years. This highlights the need to keep evaluating and improving graduate programs in speech-language pathology so that new professionals are not only well-equipped, but also supported and engaged. Overall, results of this study indicated that 66% of early career SLPs felt unprepared for professional roles following their clinical fellowship. The findings showed that early career SLPs felt there were gaps in their instruction and supervision when it came to being fully prepared for the job. In fact, only 50% of survey respondents would choose the same graduate program they attended. Experiential learning is key to getting ready for a career. As the field changes, new approaches are needed to better prepare students for success. Right now, there aren't many clear standards for SLPs to be clinical supervisors. Less than half of those surveyed felt that supervisor feedback helped guide their reflective practice, and only 44% thought it helped them build their clinical skills. These responses show there's a need for more accountability and clearer expectations around the supervisor role, especially when it comes to feedback. The data shows a worrying number of professionals leaving the field, often within 5 years. While it takes time to see results from advocacy efforts, consistent actions are necessary to ensure that SLPs have the resources, knowledge, and backing that they need to excel and make a lasting impact on the individuals they serve. My hope for the field of speech-language pathology is that SLPs will be well prepared, well supported, and empowered to thrive in their careers. I aim for my dissertation to spark conversations that drive meaningful change, promoting improved training, professional development, and workplace support. By addressing key challenges in the field, I believe positive change is possible. Thank you very much for your time and attention, and I welcome any questions regarding my research.
Thank you, Tori. I'm sorry, Tori. That's who we were just defending with. Thank you, Lisa.
My pleasure.
Yeah, I'm so pleased to see your work come to fruition. Dr. Fenster, Dr. Dwyer, do you have any questions for Lisa? I only have one question, but I can go last.
Well, one of the, oh, go ahead, Mark.
No, please, after you.
Go ahead.
No, it's unfortunate Deanna wasn't here because I know you've had some conversations with her, and she's connected with Asha, and so are you. What kind of thoughts, I mean, it's unfair to ask, what were her thoughts, and what would be the perception of your field's thoughts on these findings? Some of them are quite damning.
I really appreciate that question. Thank you. And I really appreciate her. So Deanna actually reached out to me and asked if I would join her in a conversation with ASHA. So there were, I think, 8 different directors of ASHA on the call. And we also were joined by an undergraduate student who was facing some real inequities in her journey so far as a student. And so Deanna invited me to come and share some of this information and some of these perspectives, because the research is current, and they really took it in, and they really sat with it and thought about it. And it was really an honor to have an opportunity to share current information that's directly impacting, those SLPs that wanted to share. So my hope is that leads into further conversations. Deanna, being the fierce SLP shero that she is, reached out to me this morning just to say, you've got this, and what's next? So I really do anticipate that we're going to be able to have some more of these conversations with the groups that need to hear it, and hopefully some meaningful change can come from it. So I'm happy to report that we have already been moving the needle a bit.
Get some of that in print.
Okay. I'll be reaching out to you for some stats help.
Lisa, it really struck me in this presentation as I was listening to you. You think about our program as educational leadership for changing populations. And I was really struck with how that particular area is so significant to SLPs and how it's changing and the populations are changing. And I guess, if in the best of all possible worlds, what would you see as some ways that the profession can kind of be more inclusive? And I know Deanna that's a big area for her, and I'm sure you'll be working with her on that as well.
That's a great question. I really think it's just addressing it, not being afraid to talk about it, and not kind of doing status quo, what we've always done, really looking at what the research tells us about these specialized populations and starting to incorporate that into training, into graduate curricula content. So I think it really starts with explicit instruction and then opportunities to really engage with those specialized populations and diverse, learners and diverse patients that we serve.
Thank you.
Well, I was just going to ask, if you were to pretend that you were the queen of all SLP preparation, because you identified that as one of the most important pieces that was contributing to burnout. Like what is if you could only change one thing, what would it be?
Oh, that's a great question. If I could change one thing, I think it would be training for supervisors. So right now there's only 2 hours of PD and you only have to be in practice for 9 months. And then you can suddenly supervise, these very fresh, very potentially vulnerable early career, SLPs and students. So I think it would be really developing, modules, training, a scope and sequence, and really working on accountability for that supervisory process. Because I feel like when I really sifted through the qualitative components of the data, that's where people felt most, I think, either very supported or really kind of offended and not supported. So I think if we can empower our supervisors, then that is going to trickle down into the field. So I think
Did your qualitative data give you any insight about like what was the most offensive? Like what were the offensive things that these supervisors were doing?
the supervisors didn't have enough time. A lot of it was that there was variability in their frequency of meetings, the quality. Many supervisors are also working and handling their own caseload. So I think the bandwidth was less to really be able to pour into. Also, supervisors aren't paid to take this challenge on. So I think the largest offense was that it just kind of felt kind of like, let's check the box, let's go through this, let's get you, certified, without really pouring into them, that mentoring, that growth, and giving them feedback. And feedback was also a big piece of it, was making sure that it was not only often, but that it was really, really had a lot of
Meaningful.
yeah, like kind of meaningful data that they could then grow from and use. So I think supervision is a really good place to start.
Yeah, it sounds like it. And then, I mean, it sounds like it's also a workplace factor. Like you're going to make somebody a supervisor, but then you don't give them any reduction in their normal caseload. Like how and especially if they're not paid commensurate with that leadership role, how could they have the bandwidth to actually work with the folks under them and give them meaningful feedback?
Yeah, absolutely. And burnout, definitely, that was most impacted by work experiences. So, they might be coming in with that feeling of preparedness, but once they actually got into the field and those experiences, that started to shift. So I think you're right that what's expected in the role at the workplace is pretty heavy hitting. And so, being mindful of that's really important.
All right, thanks.
Thank you.
Any other questions for Lisa?
Just one quick thing. And Lisa and I talked a little bit about this. The clinical is where I would imagine you would see those kind of practical skills integrated into it. So my question is it the clinical too? Is there a problem there where students are maybe getting skills but not learning some of the professional competencies that you're talking about that are so important?
Yes, absolutely. I think that really the content needs to be evolving at the same rate that that the profession is changing. And I think we have a lot of people, kind of in these graduate programs that have been there for a very long time and may have stepped away from some of that active clinical practice. And so sharing that, exposing that, and giving, opportunities for practice with that can be a little bit tricky. So sometimes those experiences seemed a little contrived. So because, they're trying to kind of create the scenario where you will versus really having insight into what that scenario really is. Yeah, absolutely.